Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned psychiatrist, Pavan Srivatsa, and he is the founder, president of Chakshu, which is doing the yeoman service to the people free of cost, especially during the corona, even now. And even just the other day, he went where the child was abused, sexually abused, he went to help the child. And this shows his concern for the society and the mental health. So, welcome, Pavanji.
Thank you.
This year, today, the 10th October, happens to be the World Mental Health Day. What is the slogan this year, and how do you explain that? Please explain.
Um, to be honest, this theme is for emergency in psychology and mental
Mm,
health.
mm,
Uh, the World Health Organization has always been focusing on promoting mental health and educating people about why mental health is important and fighting against the stigma associated with mental health ever since 1992.
okay.
According to what the World Health Organization says, it is not just the absence of illness that gives us the health, it is the
Mm.
well being, meaning to say physical, mental, and emotional and social well being,
Social.
which leads us to a
A-
positive.
and for that, I would like to add spiritual. That is very important. When
That
something
is for
goes
us. Yes,
terribly wrong, like
yes,
when Draupadi, she thought she is a very the queen and then powerful, but when she came into the darbar, she said, "Oh Krishna," and raised her hands. So that is the crisis. So people
yes,
should also learn when there is a crisis, they have to depend upon the Almighty, so that they can come
yes,
out of the
yes,
crisis.
yes.
So please
Yes.
go ahead. Yeah.
Yes, ma'am. When it comes to the World Health Organization and especially World Mental Health Day, the psychologists, I mean, the World Health Organization focuses more on making people understand about how important mental health is and how
Mm,
important it is to talk to a therapist or take
mm,
help. According to
mm,
one of the research papers that I have seen, only 13%, 13% of Indian population
mm, mm.
who have depression or anxiety or other type of psychological disorders are
Mm.
taking any kind of help, not
Yes,
professional or
yes.
non-professional. They are
Yeah.
taking some sort of help among that
And
13%.
to give you an example,
Yes,
Deepika Padukone, the very famous actress, and
yes,
she doesn't hide. She tells everyone during the interview that I did have depression and I came off it. And after that, she has done marvelous work. So depression should not take you to the crisis. You should not go towards the crisis or the suicide, which could be a problem. So they must try to come out. And so when you call the crisis, what are the conditions, the situation where the crisis occur in emergency occurs in psychiatry?
the first thing that I would like to say is, as we already talked about, it is suicide. The
Okay.
suicidal thoughts around all of a sudden, and that is an emergency. The second thing is homicidal. They feel like killing
Mm,
someone or doing something. Like there is something called as pyromania, where they
mm,
burn things, they see the
mm.
fire and they feel happy. There is no other
Okay.
motive behind it. There
Okay.
are these kind of symptoms. There are these kinds of disorders as well. And there will be a few situations where they'll be getting into a blackout or
Okay.
panic attack or
Panic attacks. Yeah.
yeah, yeah. On the other side, we have psychosis,
Mm.
manic state. They suddenly get into the manic state, or a family member gets into a panic attack or a manic state. Or
What do you mean by panic attack, and what do you mean by maniac attack?
manic state is a state of mind where everything looks ideal, right?
Mm,
I am the king, I am the god, kind of the god complex, what we call.
mm,
That is a manic state. They are overpowered by their
mm, mm,
emotions.
mm,
They
mm,
think that they are the most powerful.
mm, mm.
They think that they are capable of
So
doing anything and
that
everything.
is a delusion, no? It's a delusion.
That is a state of mind. That is a
Okay.
state of mind.
Okay.
When it comes to
Mm,
narcissism or
mm.
grandiosity, it is a different thing. That
Okay.
will be there
Okay.
persistently. But this, with the change in the thoughts, the behavior will also change and the emotions will also change. But when it comes to
Okay.
a delusion, It is only the belief system.
Okay.
As the
Okay.
definition of
Okay.
delusion is, it is a false, unchangeable, concrete belief that a person has, which causes problem to oneself and to the others or to
Okay.
the society.
Okay.
So,
Okay.
when a person gets into a manic state, or
Hmm.
a family member gets into a manic state, or when someone gets into, starts behaving according to the hallucinations, like they start hearing
Okay.
voices and they start reacting to it,
So that
or
occurs among the drug addicts, no? The hallucinations and
also among
delusions,
the
or even in
also among
normal.
drug addicts.
Okay,
Yeah, even
non-drug
they,
abusers. Okay. Okay.
yeah.
Okay.
There are instances where I have seen people who are having acquired brain injuries, who are
Hmm.
having these kind of delusions and hallucinations as well. Acquired
Okay.
brain injury, traumatic brain injury, drug
Hmm.
abuse, excessive usage of antibiotics, a few antibiotics or other.
Oh, I didn't know that. Which antibiotics is that? I was not
I
aware of it.
We shall talk about it on message. I will
Okay.
send you the
Okay. Yeah.
document.
Yeah. Okay. Okay.
I don't want to put the people into any kind
Okay.
of danger,
Okay.
right?
Okay. Okay. Okay.
So there are situations like this where the overdose of medications,
Hmm.
prescribed or unprescribed, leads to
Okay.
some kind of psychosis, and that psychosis is
Hmm.
something that has to be addressed immediately.
Oh, I
They become
see.
physically violent, verbally
Oh,
abusive, socially
okay.
abusive. They start, false claiming that my
No,
husband is having an affair with
usually that
someone.
occurs in the alcoholics, no? The alcoholics, when they are under the influence, they become
Intoxicated. Yeah.
abusive and then violent and then start harming. So the drugs
That
and
is,
alcohol both can cause. And in fact,
yes, it is.
95% of crimes in our country, they are all committed under the influence of alcohol. So
Yes.
alcohol is another one which makes them go into crisis, in the sense not only they develop this criminal activity, apart from that they can fall unconscious totally, and they may
Yeah,
die
yeah,
also, and they may
yeah,
die suddenly. So that's how, that also is very important. Anyone who is partying, if somebody becomes unconscious, they have to be very careful. Yeah,
yeah,
go ahead.
yeah, yeah. See, when it comes to these kind of situations, we call these as crisis or emergency in psychology.
Emergency, yes, yes.
Yes. So to which the treatment will vary depending on the presenting complaint. But
Hmm.
when it comes to suicide,
Hmm.
I would like to give an example of an incident that happened in 2017.
Hmm.
It was somewhere around 8 o'clock, 8:30 in the night. I get a call from an unknown number, and there is a lady who is talking to me, and she says, "Sir, I had called an emergency number before I called you. It is a suicide helpline number. I was not able, I mean, nobody picked the call, so I am talking to you. I have a knife in my hand, and I can
Hmm.
see my veins.
Hmm.
There is only one step ahead to
Hmm.
to slit my wrist.
Hmm.
I wanted to tell it to someone and
Hmm.
feel a little lighter, so I am telling it to you.
Hmm.
This is an emergency.
Yeah,
This is an
yeah,
emergency.
yeah, yeah.
There is
And
there
like
is
that, some people, they make the video of their own before committing suicide. In the olden days, they used to write the suicidal note and die. But suicidal night, they used to get, note, they used to get after the death. But this video they are doing and sending it. So any
they are going
person, my
live.
friends, yeah,
They are going live on Facebook. I have seen
yes.
one of those cases too. Like my one of my colleagues from another country, she said, "Pawan, you
Hmm.
see this video." I
Hmm.
mean, I was devastated to see it. So there enough, so easy going. That's the reason why the World Health Organization, like how it is focusing on World Mental Health Day, it also focuses on World Suicide
Crisis.
Prevention Day.
Yeah.
Suicide Prevention Day, which is on September 10th,
Hmm.
10th of
Hmm.
September.
Hmm.
We educate people about suicide thoughts are normal. It's okay to
Hmm.
have suicidal thoughts. And I, in many of my programs, have also
Hmm.
said,
Hmm. Hmm.
like, if you have the commitment you have towards committing suicide, right?
Hmm.
If you have 10% of that commitment to live
Hmm.
your life, you can make wonders.
Yeah, yeah.
The only thing
And
is,
I
not
think,
more.
yeah, I think I agree with you, because many people think that one needs courage to commit suicide. But just look at the stupidity. Few weeks back, a boy who has scored 99.9% and he's the topper of whole Maharashtra, and he got a seat in medical college, and he commits a suicide the day he was to join. The day he has to join the medical college, he commits suicide. That means either they are mentally deranged, though they are intelligent, they are educated. Why do they see? He could have just told the parents, I don't want to become, and that could have been enough, or someone who was with him should have told, no, don't do this, you have a bright future, don't do it. And if somebody had to, at the nick of the time, help him to come out of that crisis, then that boy could have remained, and I
Yeah,
feel so
he could have done
sad
wonders.
about it. Yeah.
Yeah, he could have
So
done
how
wonders.
important it is for the timely help at that time.
When it comes to suicidal thoughts, especially, it is a rush of thoughts and
Yes.
emotions that come to that person, which makes them
Mm.
feel worthless,
Mm.
hopeless, and angry towards oneself, and complete
Okay.
denial. I
Mm.
have heard this from a person who tried to commit suicide 4 times consecutively.
Okay. Okay.
In
Okay.
1 year, he tried to commit suicide 4 times, and I asked him, and I was
Mm.
just going through his notes, and I could
Mm.
understand that it was worthlessness, hopelessness, anger directed towards oneself, and
Mm.
there's lack of motive, and lack
Mm.
of meaning, and a lack
Mm.
of acceptance. Like, I
Mm.
don't want to
Mm.
accept myself for who I am or what has happened in my past.
Mm.
These rush of thoughts will come to the present moment, and the body reacts to it with or without the permission of the person.
Okay.
Consciousness, what we call it.
Okay. Okay.
So
Okay.
they jump into a conclusion of committing suicide. So
Okay.
we, if we pull them through that time, right? That is
Yeah.
called like how we have golden
Yeah.
time when it comes to heart
The
attack as well.
golden time, no, in the nick of the
Yeah,
time, if some help comes to them, they can come out of it. And that's
we
why the
make them come
WHO has
around
given
it.
this slogan, the crisis and emergency. So thank you
Yes,
very much for describing so nicely. And I hope all our listeners will think and prevent their emotional flow and then think with the sanity. Thank you very much.
my pleasure, ma'am, my pleasure.